Good morning, everyone. This morning, I am going to continue with the health segment as it relates to the monthly health topics throughout the country. And so today I'm going to be talking about thyroid disease. So let us begin. So what is the thyroid? The thyroid is a butterfly-shaped endocrine gland that is located in the lower front of the neck. As small as it is thought to be one of the most powerful endocrine glands. This is what the thyroid actually looks like, right here, right above your trachea and your windpipe is here. This is the front of what it looks like. This is the thyroid gland, and this is the inferior, the back bit. What is the role of the thyroid? The role of the thyroid is to make thyroid hormones. These hormones are secreted into the blood and then carried throughout the body. The thyroid controls the body's metabolism, increases heart rate, and affects how fast things move through the body, such as food, bone loss, and sugar. It is responsible for regulating skin integrity, menstrual cycles, calcium levels, and the nervous system, heart and cholesterol levels. In addition, it controls brain development, your body temperature, again, as speaking about your skin integrity and your temperatures, respirations, metabolism, and fat production. Thyroid problems begin to occur when the thyroid gland produces too much hormone, which is called hyperthyroidism, or not enough, and is called hypothyroidism. And this is what a normal thyroid looks like. And this is what an enlarged thyroid looks like. And I'm going to go further into that. So who is affected by thyroid disease? Thyroid disease can affect anyone: men, women, infants, teenagers, and the elderly. It can be present at birth, typically hypothyroidism, and it can develop as you age, often after menopause in women. Thyroid disease is very common, with an estimated of at least 20 million people worldwide having some type of thyroid disorder. A woman is about 5 to 8 times more likely to be diagnosed with a thyroid condition than a man. You may be at greater risk of developing a thyroid condition if you have a family history of thyroid disease, you have a certain medical condition. These can include pernicious anemia, type 1 diabetes, primary adrenal insufficiency, lupus, rheumatoid arthritis, Sjögren's syndrome, and Turner's syndrome. If you take a medication that is high in iodine, amiodarone happens to be one of those. If you're older than 60, especially in women, and have had treatment for the past in thyroid condition or cancer, having a thyroidectomy or radiation. I want to pause here for a minute and just to let you publicly know that when you go to a doctor, you have to have a chest x-ray. You know, they put a vest over you to protect your body from radiation. There's also one for your thyroid. So you can feel free to ask for what's called a thyroid guard, because they might not necessarily offer that to you. Some of the different thyroid diseases include goiter, an enlargement of the thyroid gland, hyperthyroidism, as I discussed earlier, which happens when your thyroid gland makes more thyroid hormones than your body needs. Hypothyroidism, which happens when your thyroid gland does not make enough thyroid hormones. Thyroid cancer, thyroid nodules, lumps in the thyroid gland, thyroiditis, swelling of the thyroid. This is goiter. A lot of us in the islands, I remember growing up as a little girl, and you see people with this at their neck, and you're like, oh, what's wrong with them? Well, now that I'm a nurse, I fully understand what it is. Signs and symptoms of thyroid problem. There are a variety of symptoms you could experience if you have a thyroid disease. Unfortunately, symptoms of a thyroid condition are often very similar to the signs of other medical conditions and stages of life. This can make it difficult to know if your symptoms are related to a thyroid issue or something else entirely. So it's important that you speak to your physician and get yourself worked out. For the most part, the symptoms of thyroid disease can be divided into 2 groups. Those related to having the too much, which I explained earlier, the hyperthyroidism, and those related to having too little, which is hypothyroidism. Symptoms of hyperthyroidism can include experiencing anxiety, irritability, and nervousness, having trouble sleeping, losing weight, having an enlarged thyroid gland or a goiter, which I showed earlier, having muscle weakness and tremors, experiencing irregular menstrual periods, or having your menstrual cycle stop. feeling sensitive to heat, having vision problems, or eye irritation. Conditions that can cause hyperthyroidism include things like Graves' disease, nodules, thyroiditis, and excessive iodine. When you have too much iodine, the mineral that is used to make thyroid hormones in your body, the thyroid makes more thyroid hormones than it needs. Excessive iodine can be found in some medications. I discussed this one before, amiodarone, which is a heart medication, and also some cough syrups. Symptoms of hypothyroidism can include feeling tired or fatigued, gaining weight, experiencing forgetfulness, having frequent and heavy menstrual periods, having dry or coarse hair, having a hoarse voice, or experiencing an intolerance to cold temperatures. Conditions that can cause hypothyroidism include thyroiditis, Hashimoto's thyroiditis, postpartum thyroiditis, iodine deficiency, and a non-functioning thyroid gland. Sometimes the thyroid gland doesn't work correctly from birth. This affects about 1 in 4,000 newborns. If left untreated, the child could have both physical and mental issues in the future. All newborns are given a screening blood test in the hospital to check their thyroid function. Diagnosing thyroid disease. One of the most definitive ways to diagnose a thyroid problem is through blood tests. Thyroid blood tests are used to tell if your thyroid gland is functioning properly by measuring the amount of thyroid hormones in your blood. Doctors can also do a physical exam. Imaging tests. In many cases, taking a look at the thyroid itself can answer a lot of questions. Your healthcare provider might do an imaging test called a thyroid scan. This allows your provider to look at your thyroid to check for an increased size, shape, or growth, otherwise called nodules. Now, these are what would happen if they do the blood tests. When you have hypothyroidism, your T4 level, the check will score your T4 and your T3 levels, and you see different upticks in them. I can discuss later on next week, which I'm going to be doing part 2 of what those blood tests mean. Now, you yourself can also do certain self-checks at home, but I don't want you to panic if you find something. And this is how you do a self-check at home. You hold a hand mirror towards your neck about the collarbones, where you can see the area below your Adam's apple, which is right here. You're going to tilt your head back and take a sip of water. Don't take too much sip. I don't want you to choke on it. Swallow the water and watch your neck for signs of any bulging. So as you tilt back and you swallow, any bulging, you want to look for that. You want to repeat the steps a few times to make sure you don't see obvious signs of bulging. If you discover a bulge, nodule, or an enlarged gland, contact your physician. The only way to be sure if you have a thyroid disease of any type is to have a blood test that measures your thyroid hormone levels. To confirm whether there's a thyroid concern, your physician may perform thyroid stimulating hormone tests, which were the labs I was speaking about earlier. This blood test measures whether the gland is working properly. Diagnosing thyroid disease in seniors can be difficult because some of the symptoms are also associated with aging or other medical condition. It is natural to assume symptoms such as memory issues, constipation, or weight gain are part of the aging process. However, these can also be signs of thyroid disease. Thank you so much for your time and attention. I will continue part 2 next week. God bless and enjoy the rest of the service.